So I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana, one of the co-founders, and I want to welcome you to our Wednesday night call. Our Wednesday night call typically will discuss a certain challenge, okay? I'm not going to say disease entity, but I'm going to say a different challenge that you may have in your life. But once in a while, once every 2 to 3 months, I don't do a topic, but what I do is a general overview, and then we can specifically talk about any question you may have. Okay, so this is a great time because many times when I'm talking about glaucoma, someone's asking me about a totally different topic than glaucoma, right? So this is a great time that you can absolutely, oh, good. I've got some questions already. This is a great time for you to load up the chat with questions. So let's see if I can share my screen here. And we're gonna first just dive right into the 2018 Farm Bill. So if you're a guest on the line and you are wondering if this CBD stuff is legal, the answer is yes. Yes, CBD is legal, and under the 2018 Farm Bill, it was legalized after many, many decades, right, to be removed from the Schedule I drug listing. So a Schedule I drug is a very, very harmful drug. It's a drug that is very addictive, and it's something that has some severe safety issues. So what we're talking about is an agricultural crop. It's called hemp. Hemp in 2018 was legalized to not only cultivate and farm and to grow, but to also utilize and to sell. So we're going to talk about what hemp is, how it's different from marijuana, but just know that hemp, which our products are all sourced from hemp, is legal. So let's look at what CBD is, because if you were invited here tonight, you were invited because your friend, your loved one, your coworker sells CBD. And maybe you're like me, because 4.5 years ago, I had no idea what CBD was. In fact, the CEO of this company reached out to me at the time we were with another company, or before we were with another company, and asked me what I knew about CBD. Well, I was so embarrassed to tell Melissa I didn't know anything about CBD. I had never heard of CBD. I heard of hemp and hemp seeds, but not CBD. But let me tell you folks what happened. When I start to study and dig and research about CBD and its benefits to the body, I was absolutely sold. And why was I sold? Well, myself, I was having some issues with my right knee. Many of you may not know, but I'm a big skier. I've been skiing since I was 4. I'm going to be 60 next year, so you can imagine how many years I've been skiing. And I had a ski accident in 2019. You know, I waited until I was about, how old was I in 2019? You guys can do the math. I think I was 45 or so. I waited until I was 45 years old to have a ski accident. So I'm in the mountains, I'm racing, right? I'm racing, I'm competitive, I'm trying to win this race. And I hit a ski embankment and tore my ACL, my MCL, my meniscus. So I initially was very excited to use CBD because I would wake up in a lot of pain. I would wake up very stiff. I never had surgery for my torn meniscus. And ACL and MCL, you know, physicians are the worst patients. I'm one of them. And I was just dealing with the pain. But I'm telling you, within 24 hours of using CBD, I saw amazing, incredible relief for my knee. It wasn't stiff. It wasn't as inflamed. It wasn't as swollen. And so I was sold, and I started recommending CBD to my patients and then my family members. So that is my story behind CBD. And I want you to take the next 15, 20 minutes to have an open mind and open ear about our product. So CBD, it's an abbreviation for cannabidiol. And cannabidiol is one of the top cannabinoids that is produced from the cannabis plant. Now, the number one cannabinoid or compound is called THC, or delta 9 THC. But just know that CBD and THC are the two main compounds that the cannabis plant makes. So let's look a little closer with the cannabis plant. The cannabis plant has two species. One is marijuana. That's a species that gives you the high, the euphoria, the paranoia, and sometimes it can also give you the munchies. And then we have hemp. Hemp is what we call the plant species that gives you the health without the high. So though CBD and THC can be found in both marijuana and hemp, it's really the makeup, the percentage that is the reason why marijuana gives you high. See, marijuana has a high THC level, about 20% or more is THC in marijuana, where it has a very low amount of CBD or cannabidiol. Now, the reverse is true of the hemp plant. See, the hemp plant has very low amounts of THC and very high amounts of THC. And so this is why when you utilize CBD products that are sourced from the hemp species, like our Wakana products, you don't get high. You don't get the euphoria, you don't get the paranoia, and you don't get the munchies. But what you do are you get the health benefits. So let's look at the other major players, because the cannabis plant produces you'll see some studies that say 85, but really the cannabis plant has now identified more than 140 compounds that it produces. But these are the main ones. We talked about CBD, we talked about THC, but the other main cannabinoids are listed here, like CBDV and CBG and CBN and CBC and delta 8 THC and THCV. See, all of these cannabinoids play a role in putting our body back in balance. We call it homeostasis. But when we look at the real player, the real true hero or shero is CBD. See, CBD has so many medicinal benefits. CBD is an antibacterial. This is why you're seeing so many products that are used either for the scalp or for the face, because it's addressing the properties of being an antibacterial, reducing the bacterial load that can be found in the scalp and on the face. CBD inhibits cancer cell growth. Not only does it inhibit cancer cell growth, but it also reduces nausea and vomiting. So for these two reasons, oncology doctors that deal with cancer, are using CBD for their patients. They're recommending this for those patients who maybe have nausea and vomiting, right? But the studies also show it can stop the progression of cancer cells from growing and metastasizing. CBD is also neuroprotective. It helps to protect nerves that have been damaged. See, nerves can be damaged because of a trauma, an accident. Nerves can be damaged because of a chronic disease state like diabetes that causes neuropathy. Nerves can be damaged because one may have had a stroke. So all of these neurodegenerative conditions, CBD can assist with. CBD also promotes bone growth. You're seeing orthopedic doctors using CBD to help facilitate the growth of the bone after a fracture. CBD reduces seizures and convulsions. You're seeing neurologists using CBD for those who are on medications that help to reduce seizures. CBD also reduces blood sugar levels. So your internists, your endocrinologists are recommending CBD for their diabetics. They're type 1 and they're type 2 diabetics. Why? Because CBD is an anti-inflammatory. It can come and reduce the inflammation in the cells of the pancreas that are responsible for producing insulin. CBD also functions in the immune system. So not only is it important to use during this global pandemic in helping to boost our defense, but it also helps to address autoimmune conditions like lupus, multiple sclerosis, rheumatoid arthritis. All of these autoimmune conditions are a result of our immune system being hyperreactive. I call it the immune system with ADHD, right? So CBD can come and balance the immune system. It also helps to reduce the risk of arterial blockage. So cardiologists are recognizing its benefits in not only reducing cholesterol, but helping to reduce the blockage that occurs in arteries. It helps to reduce nausea and vomiting. We talked about that earlier, but it also reduces intestinal contractions. Those are folks that have ulcerative colitis or Crohn's or diverticulitis. It helps to relieve pain. That's the number one reason why people use and choose CBD. It's for its ability to reduce pain. And it does it, and we'll talk about different pathways in the central nervous system and the brain that modulates and regulates pain. Well, it comes in and works on those pathways. It helps to reduce anxiety. Oh my goodness, how many of us are under a tremendous amount of stress and anxiety, right? It does that by releasing more dopamine and releasing more serotonin in the central nervous system to relax and to calm and to help to address anxiety. It also will suppress muscle spasms. We talked about multiple sclerosis. Multiple sclerosis is an autoimmune condition that is very debilitating, causes a lot of muscle spasms, and even in those who have restless leg syndrome, CBD can assist with that. It treats psoriasis, acne, eczema. So many people, especially our teens, have skin disorders that CBD can not only reduce inflammation, but again, reduce that bacterial load. It's a vasodilatant or vasorelaxant, meaning that it can cause the vessels in different parts of the body to dilate, the blood flow to improve. So we're seeing folks who have hypertension, high blood pressure, get a lot of benefit in using CBD. So hopefully you understand all of the many or some of the many benefits that CBD can allow for our body to get back into balance. Again, you see the other players like CBC and CBG and CBN and Delta 8, all of these cannabinoids also at a lesser degree help to reduce inflammation, helps us sleep, helps us to be less anxious and stressed out, and also helps to reduce nausea and vomiting and many more benefits. Now, there's another part of the plant that I want you to know about, and that's terpenes. Because when you consume some of our products at Wakana, you can actually taste the terpenes. And I challenge you out there, if you've already received your products, when you taste some of the gummies or when you place that tincture under your tongue, you may notice that there is an aroma or a flavor. It could be kind of a woody, peppery, kind of lemony, whatever that word is, aroma or taste. Well, those are the terpenes that are within our full spectrum products that you are tasting. And these terpenes, guess what, guys? They have medicinal properties too that benefits the body. Carafilene, limonene, myrcene, pinene, all of these different terpenes help to reduce anxiety, help to reduce stress, depression, helps to reduce inflammation and pain, helps to improve mood. They say if you take lemons and you cut the rinds of the lemon and you strategically place them all around your home, it will improve and lift your mood. So the terpenes are responsible for the aroma and smell, but terpenes also have medicinal benefits that enhance the CBD as well. Flavonoids, again, are a part of the plant. Flavonoids are very powerful and potent antioxidants. Antioxidants improve the ability of the body to not destroy free radicals in the body, destroy and harm different organs and glands. So these flavonoids come in and they remove the ability of those free radicals of tearing our body apart. So flavonoids are a part of our products, especially our full spectrum products, along with the terpenes and the CBD. So when you put all of that together, it's called the entourage effect. The entourage effect is the ability of a full spectrum product to have all of the key cannabinoids, all of the key terpenes, and the key flavonoids to work synergistically on the body to enhance balance. So the endocannabinoid system, oh my goodness, this is the system that explains how CBD works. So if you're on the line and you're trying to figure out, well, how does this work in my body? And is this a snake oil? Is this a magical potion? Like, what is this that can do so much? So the human endocannabinoid system is the physiological system that explains how CBD works. It's the science, right? And when Melissa told me about CBD, the next question is I've got to see the science. So the science is explained simply by the fact that we all have a human or an endocannabinoid system, and it's made up of receptors that are found in major organs and glands throughout our entire body: our liver, our lungs, our kidney, our spleen, our stomach, our skin, our intestinal tract, our thyroid, our thymus, our uterus, our ovaries, our testicles. All of these major organs and glands have receptors that are looking for cannabis products, that are looking for the CBD and the CBN and the CBG and the Delta 9 THC and the Delta 8 THC. And the main receptors are called CB1 and CB2. Now, CB1, these main receptors are found in the brain and the central nervous system, and the main CB2 receptors are found in the immune system and the periphery. So what that means is that literally every single organ and gland and every main receptor pathway in our body is looking for CBD to attach to and to send a signal to different areas of the body to put our body in balance. So this is how CBD works. And this is why CBD is so effective in working in our body to bring balance. So these are those other additional receptor pathways that I spoke about. And look at the science. Like, take a moment and look at the fact that this pathway is responsible for vasorelaxant. This is a pathway that's responsible for getting and improving blood flow to our heart or to our lungs or to major organs and glands. And look at this. This is the pathway that explains how CBD works on those who have diabetes. So there is a specific pathway that helps to regulate blood sugars. Let's look at one more. Let's look at this one, TRPV1. It says analgesic. Well, this is the pathway that is responsible for the fact that I have never, ever put a Motrin, an Aleve, or a Tylenol in my body since I was introduced to CBD 4.5 years ago. Why? Because CBD has a specific pathway that regulates pain, reduces pain in the body. So hopefully you can see, I can go on and on and on all night, but you can see all of these different pathways. There's one for anxiety, there's one for psychosis, there's one for seizures and epilepsy. In fact, maybe you should just screenshot this slide so that you can really reference this when someone asks you if CBD can assist with their condition or their challenge. So this is just some more slides that really home in on the way that CBD works for reducing pain. It's the same concept when you think about, well, when I take a Tylenol, when I take a Motrin, when I take an Aleve, when I take a Tylenol #3, or when I take a Norco, well, how does it work in my body to stop pain? It's the same concept. There are pathways that send signals to reduce the pain threshold and to reduce pain. So there are many ways of consuming CBD, right? You can take a capsule, you can eat a gummy. By the way, I love our gummies. You can use our tinctures that are placed underneath the tongue. You can use our topicals. By the way, I love me some Power Extreme Topical and Dr. Rita's Rub. You can vape or pre-roll. I love my vape. And then there are water-soluble liquid. So there's really so many different ways you can consume CBD. It really depends on your preference. But let me tell you, folks, if you have some pretty significant challenges in your life, we recommend here at Wakana that you layer, what we call layer the products, that you use more than one way of consuming. We recommend that you consume the tincture, that you consume and use the topical, and you consume and use the gummies and possibly the vape as well. So there's different methods when you consume CBD that it will absorb in the body. So that's why we talk about layering these products, because the fastest way to get CBD in your body is by vaping or smoking. But you know what? There may be some of you out there that don't want to smoke. They don't want to vape. That's just not their preference. They would rather eat a gummy, they would rather use a tincture, and they would rather use a topical. And that's okay. Absolutely, that's okay. But just know that when you use different forms and different methods, that each particular way of consuming has its own ability or bioavailability to get into the cells. So topicals, which offer local relief, have a less bioavailability. And then as you go up the ladder from capsules to edibles to tinctures, again, you can see that the vape is the fastest and quickest way of getting the CBD into the bloodstream. So that's on bioavailability. So let's talk about some of our products here. I'm going to skip some of these slides. But let's talk about some of our products. We have products that are very effective. We have products that are very safe. Now, being a chief medical officer, that's my #1 concern, that we are offering safe and effective products to the marketplace. And we do that by validating our products in a lab that is a third-party validation, right? We want to ensure that there's no bias. We want to ensure that we can get our products tested by a lab that is a credible ISO certified lab that will test potency, that will test for mold, mildew, heavy metals, pesticides, and residual solvents. That's a lot of words, Dr. Rita, But all that means is that you want to make sure that when you consume a CBD product, that you are not consuming mold, you're not consuming heavy metals, you're not consuming pesticides. Because guess what, folks? All of those things, if you consume and are in a CBD product, will make you sick. So, FDA disclaimer is that the statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by the FDA approved research. These products are not intended, I repeat, not intended to diagnose, treat, cure, or prevent any disease. We cannot make any claims that any of these products will cure your disease, okay? That's got to be clear. If you are under a doctor's care, if you're on medication, just loop your doctor into all of this and help your doctor understand why this is absolutely a very great option for you and your wellness, and is just another tool in the toolbox. So this is a picture of myself with the lab. Again, this is Green Scientific Lab. We partnered with them, what, a year and a half ago, and they do all of our testing. We offer certificates of analysis. These are on every product that we offer so that you can utilize these certificates to see the potency, the quality, and the safety of our products. So let's get right into some of our products. We offer products by industry. We have products that are for weight loss. In fact, we have some amazing CBD and non-CBD products that we offer for weight loss. We have a wellness immune product line, and we know how important the wellness and immune product line is during this season. We have a hair care line that addresses issues like alopecia. We have essential oils because I'm telling you, we have something called our First Defense, our nasal spray that utilizes essential oils and CBD. We have skincare. We have a serum for the face. We have body creams and lotions, right? We talked about the importance that CBD reduces a bacteria, reduces inflammation, so that serum for the face is absolutely a must, especially for us women that don't want to see those wrinkles. So let's talk about our full spectrum versus broad spectrum. Full spectrum are our power products. You're going to see products that have a black label and they have the word power. Whenever you see that, that means that this product includes those important cannabinoids we talked about, like CBN, CBG, CBC, and terpenes, and flavonoids, and the legal limit of THC, which is 0.3% or less. That's the legal limit of THC. Now, broad spectrum are a little different. These are products that contain less than 0.0% of THC. So this slide is not really accurate because there's a little bit of THC in there. It's at a very, 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 very minimal amount. It also includes those important cannabinoids and terpenes and flavonoids. Now, a CBD isolate is just that. It's just CBD and nothing else. So let's look at our tinctures. Tinctures are products that you would use underneath your tongue. Now, we talked about full spectrum. So you see here, it says power. Whenever you see the word power, then that means that's a full spectrum product and contains the legal limit of THC, which is 0.3% or less. Now, our tinctures, like our Hempranium, 500 milligrams, is an amazing product because it is and has a proprietary formulation. Like no other CBD company out there, we have a proprietary formula that includes CBD, essential oils like black seed and turmeric, and is in a carrier oil of MCT coconut and hemp seed oil. That's what really makes this product unique. It is the #2 seller of our company, this product right here. And then we'll move on to our water soluble. It's a product you can add in water or any liquid, smoothies, coffee, tea, etc. It's great product for those. I like to recommend the water soluble for product for people who have dementia or someone who has a very limited cognitive ability to hold an oil under the tongue. Then we have our more potent product. It's our Hemp MD. It's our therapeutic product of CBD. It is an amazing, incredible product for those who have more severe challenges in life. Now let's move on to our broad spectrum product. That's our pure product. So if you undergo random drug screens at your job, this is the perfect tincture for you. It is, again, a unique product. It utilizes nanotechnology. Nanotechnology allows for the CBD molecule to become more water soluble, which enhances its bioavailability to 98.7%. So pretty incredible products that we have here. The tinctures are taken twice a day. That's a great starting regimen. 3 drops under the tongue twice a day. Again, placing those drops underneath the tongue, hold it for 60 seconds before you swallow so you can improve the bioavailability. So I love this slide because this slide reminds me to tell you that the Mayo Clinic did a study, and it's pretty impressive. They looked at a lot of participants in their study that had chronic severe pain. And they looked at, well, how much CBD does this person need? Well, they found that chronic debilitating pain, that person needs between 2.5 and 20 milligrams of CBD with or without THC under the tongue. And you know what? That's not a lot of CBD. That's 3 drops under the tongue twice a day, CBD. So our edibles are really incredible. You know, we really were having a hard time keeping these gummies on the shelf last year because they are such a high ticketed product. We have our full spectrum gummies, our power gummies. We have our broad spectrum gummies, which is our pure gummies. And then we also have a flat belly brew. Our flat belly brew and our flat belly gummies are products that are really helping to get our weight back into the best version that we would like to see it. So those are specialty products that also utilizes CBD to enhance weight loss. We have other edible products like our bitter teas, our immune defense tea, and these are great products for those who want to address this global pandemic, for those who want to address this flu season during this very unique time. Now, one of our newest addition to gummies is our Delta 8. Now, I'm going to talk a little bit about Delta 8. Delta 8 is a new cannabinoid that's been recognized for medicinal benefits. It helps with creativity. It supports and enhances sex. It supports sleep. It's slightly energizing. A lot of millennials, like my children who utilizes our Delta 8, states that it really helps them to be more calm, less anxious, and helps them to be more creative. But I would like to say that this Delta 8 is a great product for those who think that, you know, the CBD was good, but it really didn't address my issues like I thought it would. Well, Delta 8 is for you. It is more potent than CBD, and it absolutely will allow the CBD to work more on the body and less on the brain. So it is legal. It is very close cousin to Delta 9. So if you've ever used Delta 9, you've ever smoked, be honest, be honest. If you've ever smoked marijuana and you did not have a good experience, then Delta 8 will not be for you. Why? Because it is such a close cousin to Delta 9. Now, our topicals offer local relief for those achy, sore muscle joints. Oh my goodness, our Power Extreme Pain Cream is our #1 seller, right? Coming in third, because I think the #2 is Sympranium 500. Coming in third is Dr. Rita's Rub. I'm just saying that because it's my name, but Dr. Rita's Rub is an incredible product because it offers local relief to those sore joints, but in a roller ball method. That's what I love. You don't have to stick your finger in the jar and get the product all over your fingers, but you can just use a roller ball and be done. Another topical that I'd like to draw attention to is our Holy Glow. That is our CBD product. That is a facial serum. We talked about how us women don't want to see a wrinkle, so get you some Holy Glow in your life. Our Power Mango Body Cream is a topical lotion. Incredible. A lot of testimonies of folks using the body cream, they've noticed that their pain has reduced because it is a topical CBD product, but a lotion. We also have other body butters that are great to help to improve the mood if you're trying to get in the mood in the bedroom. Our smokable products, offer very fast relief within 1 to 5 minutes. Smokables are great for those acute conditions, conditions that you need relief within 1 to 5 minutes. We have smokables in Delta 8. We have smokables in our CBD, and we also have pre-rolls and fresh flower. Now, there is a bit of a weight on our smokables, but just know that if you undergo random drug screens, you will not be able to use our smokables because they will show up on your drug screen. So let's see our culinary products. Oh my goodness, if you know any chefs or maybe you love the kitchen, you want to pick up these products, our spices, our garlic fire, our flavor king, our chili lime, our vegan butter, all infused with CBD. If those products are not available, you absolutely want to get our Culinary Plus, where you can bake and cook with this product. It is amazing. Just remember that if you are cooking, don't cook or bake over 350 degrees. No, you won't blow up your kitchen or your stove, but yes, you will cook off all of the benefits of your CBD. And you don't want to cook off your CBD. You want to maintain that CBD in your product. Our flat belly product line comes in phases, phase 1, 2, and 3. With phase 1 and 2, you absolutely can utilize the flat belly gummies, the flat belly brew, and our bitters. This is an amazing product where we've had so many folks lose the weight and they are feeling great, more energized. They're eating a plant-based diet. They're eating in accordance to their blood type. And these are products that can assist in turning that white fat into brown fat. That's the fat that helps to improve your metabolism. It also, these products reduce your appetite, reduces your cravings for sugars and carbs and all of those bad things we shouldn't be eating. This is a product for you. Our hair care system, again, addresses a global pandemic. You know, we're seeing an increase in hair loss. Why? We're seeing an increase in hair loss because we're seeing an increase in chronic conditions. I tell you all the time that when I was in medical school, I never saw a patient with lupus. I went to medical school in the early 90s, late 80s, right? Now 1 out of every 4 people have an autoimmune condition. So a lot of these autoimmune condition, guys, are linked with hair loss. So we're seeing a rise in hair loss. We have products that address that. Our save our strands. Products help to address alopecia, hair thinning, hair loss, or maybe you're on the line and just want to maintain the healthy hair that you have. You want to use these products. Sexual health is a concern as well. Menopausal men, menopausal women go through changes, so they need these products. Our CBD lube addresses vaginal dryness, vaginal atrophy, uncomfortable intercourse. Our King of the Jungle addresses libido and stamina and energy. These are products you absolutely want to use to enhance and to improve your sex life. Again, the essential oils, I want to concentrate on this one here. Our First Defense is a nasal CBD product with essential oils. How do the viral particles get in our body? Very, very easily through our nasal passageway. You want to protect that. We have other essential oils, all organic, that are amazing, that can be used topically. Some can be used, many in diffusers, but they are great products to have in your home. So there are many, many products. There's many, many packages. You know, many of you on the line are distributors, started your business with our full crown jewel dispensary. Some of you came into the business as starter packs. These are smaller packs that utilizes the ability to start a business and start our products as well. But just know that these products, when you buy them in respective packages, you're getting a huge savings. You're getting a huge discount, and you want to either utilize these products in a package so that you can share with friends, you can bless others with, and it's much cheaper than buying them a la carte. So if you were invited on the line, of course you were invited on the line because you wouldn't just magically show up here, but you want to connect with the person that invited you on this line so that you can get more information about coming into the business, or maybe you just want to be a customer. Maybe you just want to start to utilize these products so that you can get your body back in balance, or maybe you want to utilize our products so you can lose weight, because you know that's what we're doing now. We're doing the flat belly 2.0. Many of us are on the 21-day cleanse. I'm on day 11, feeling amazing, feeling full of life, feeling energetic, feeling like I was 21 again. But just know that if you're on the line and you were invited, which again, of course you were invited, you didn't magically just show up here. You want to connect with the person so that they can get your products ordered, they can get you to their website, and we can get you started. So I'm going to take questions now. You can put the questions in the chat. You can put the question in the Q&A. One question, and I wish I knew who this anonymous attendee was. I feel like it's a mystery guest. But if you're the anonymous attendee, put in the chat what your name is. The question is, will any of our products assist with COVID symptoms? Well, you know, that's a great question. We can't make any claims, and especially not about COVID, because COVID is such a daily chameleon, right? COVID and its variants are changing every single day. But what I would say about our products, and if you are looking for a product to keep your immune system strong, I definitely would order our immune defense package. It comes with these products that are going to assist and build your immune system, because I say it all the time. You can't control this virus, but you can control the host, which is your body. You know, our immune defense tea, utilizing CBD every single day, utilizing the nasal defense, utilizing the essential oils, making sure that the air in your home has the essential oils that are helping with your lungs to stay healthy and strong. You know, all of these products, excuse me, can improve your immune system by the very fact that it's reducing inflammation and it's putting the body in balance. It's putting the body in homeostasis that can assist with this immune response that your body naturally will have, excuse me, naturally will have when the virus attacks your body. So to answer the question, the immune defense package is the package you should order tonight if you're looking for products that will help assist with the COVID-19 virus. Hopefully I answered your question. Yes, I am aware that my video kept going on and off, and that was because I was accidentally hitting that little button. I thought my little mouse was on my screen, but it was on the video button. 2 questions. Which one of our products is good for headaches? Question 2, I have 2 customers who have a bad case of arthritis. Which gummies are best? And I've also told them to get our extreme pain cream. So let's attack the first question. Which products are good for headaches? Headaches, migraines are very debilitating. One product that you definitely want to utilize is our peppermint. Our peppermint is an essential oil, and peppermint, if utilized right on the temple, the back of the head, or the occipital area, using a small amount, 1 little drop, will take that headache away immediately. Another thing you want to do is find out what are the triggers for headaches and migraines. Many times triggers can be food, can be alcohol. You want to make sure that you eliminate those triggers, and you want to get CBD into your system. You want to get on a regimen of tinctures twice a day, 3 drops under the tongue twice a day, and you want to utilize either the power or the pure gummy every day. You want to make sure that CBD is in the system at a steady stream, right? So that you can prevent headaches. You really want to be proactive and not reactive. So you want to get on a regimen of the tincture twice a day, your gummies at night so that you can sleep, and absolutely using the peppermint if you get a headache to really address that headache. Question number 2, you have 2 clients that have arthritis. Again, with the arthritis, you want to utilize either the Dr. Rita's rub, the Power Extreme Pain Relief. You want to utilize the tincture twice a day and the gummies at night. With arthritis, it's inflammation. So you want to do everything to reduce the inflammation, and that's utilizing the products in layers. You want to get them on that flat belly challenge, either phase 1, 2, or 3, because many people who have arthritis are overweight. And the fat cells release a lot of inflammation and causes a lot of pain. So yes, you're on the right track with the extreme pain cream. I would add the gummies, and I would add the gum and the tincture. Never ever give a client just one thing. You always want to layer tincture, gummies, and topicals, especially when they're addressing arthritis or any pain condition. Any other questions? I have a friend that suffered a stroke, asked if the MD tincture will help his speech. Again, we can't make any claims. So yeah, when people ask you stuff like that, you have to lead with, we can't make any claims. But what we can offer you are amazing, incredible products that can assist with some of the symptoms. So with the speech, hopefully they're working with the occupational therapist, but you want to get CBD in their system. Why? Because we talked about CBD is a neuroprotective, right? Someone who's had a stroke, someone who's had nerve damage due to trauma. CBD is neuroprotective. It's going to help reduce the inflammation around the nerves. It's not going to, and we can't say it's going to allow this person to talk like normal again, but it will help to relieve anxiety, it will help that person sleep, and it will help to reduce the damage and the inflammation around the nerves that happen during a stroke. Wonderful. Hopefully I answered that. We have more questions. So can we use these products while doing the cleanse? No. If you're doing the cleanse, you're only going to do the cleanse. The reason why you don't want to use these products during your 21-day cleanse is because you will cleanse it right out of your body. It's called a detox. So for 21 days, you can use the topical, but you are utilizing only the products in the cleanse. You're drinking your 3 juices, you're eating your salads twice a day, you're using your superfood, your eliminator, the liquid colonic purifier, and your fruits, your vegetables, and your nuts. That's it, right? That's it. Perfect. Hopefully I answered that. And I think that's it. I think we did great. Any other questions? Let me know. And anonymous, the person that put the question in the Q&A, can you tell me who you are, please? Can you put your name somewhere? I'm just curious as to who that is. Anonymous attendee. Who are you? The mystery attendee. Wonderful. So if you're a guest on the line, and I think we do have a guest, we have Miss Alfra. Yes, Alfra. If you're a guest on the line, please connect with the person that invited you so that you can get your products ordered. You can get your products ordered tonight. Okay, so the anonymous attendee is, can you give me your last name? Niena. Yes, give me your last name. I would love to meet you and know who you are. Wonderful. Thank you so much. I will let my clients know about your answers to my questions. Great. So wonderful. Yes, connect with the person now. When you hang up, call them so we can get your products ordered, and we can get that shipped out. And all of you, so Naimi Feme, welcome to the call. That's our anonymous attendee. Thank you for the questions. Get your products ordered. Join our Flat Belly 2.0 if you're looking for some weight loss and weight management products as well. We'll see you next week, this time, 8 o'clock. Be well, be safe, and God bless you all. Good night.